this episode, we have with us Dr. Deepak Varma, who have been specialized in gastrosurgery. Let us welcome him to the program. Welcome, doctor. First of all, we would like to know more about you.
I am practicing Gastro Surgeon in Kochi. I did my undergraduate from Trichy Medical College in Kerala. Did my general surgery postgraduate from Pondicherry, Jipmer, and did my super specialization in gastrosurgery from Trivandrum. After that, I had some special training in laparoscopic colorectal surgery, bariatric surgery, and also liver transplantation and hepatobiliary surgery. Now I am practicing gastrosurgeon in Kochi.
Doctor, we have received some emails from the viewers, mainly from UAE. So we will move on to the questions now.
Yeah, definitely.
So the first mail is from Ahi, Abu Dhabi. How do I know if I am eligible for weight loss surgery? And is weight loss surgery right for everyone?
Basically, weight loss surgery is done for people who are obese. That means they are well above the ideal weight. Each person, according to his height and according to his frame, has got an ideal weight. If person is more than his ideal weight, we calculate something called BMI, body mass index. Body mass index is weight in kilogram divided by height in meter square. So if body mass index is beyond a certain point, for example, if it is beyond 30, and if the patient has some comorbidities like diabetes or sleep apnea, or if he is uncontrolled hypertension, then he is eligible for bariatric surgery. Worldwide, the definition or indication for bariatric surgery is a BMI more than 35. So the eligibility is if because of this obesity, if the life of this patient is under threat due to other diseases related to obesity, then the patient should undergo a bariatric surgery. Okay. So that is the eligibility criteria.
The other question that she has asked is, will the weight loss be quick and can I become pregnant after weight loss surgery?
Weight loss is quick initially, but the ideal weight or the maximum weight loss would take probably 1 to 1.5 years. But initially there is significant weight loss in the initial 4 to 6 months also. The second question is whether you can become pregnant after this surgery. Definitely, because the chances of getting pregnant is better after bariatric surgery, because obesity and irregular menstruation, irregular ovulation and all go hand in hand. So if you get a bariatric surgery done properly, if you lose weight, then the chances of you getting pregnant is better. So I think if you are obese, you should go for bariatric surgery and definitely the chances of pregnancy is better.
The last question that she has asked is, what is my first step and how long will I have to stay in the hospital after surgery?
Okay. Usually bariatric surgery requires some amount of counseling and some amount of diet control initially, because after bariatric surgery the lifestyle, your lifestyle is going to change. Your eating habits are going to change. So usually what we do is in our clinic we see the patient, we counsel what type of surgery you are going to undergo, then dietary counseling is given, and the most important thing, how much weight loss you should expect. So I think you should, the first step is to start dieting, start reducing your intake, do some regular exercise, and if it fails, then go for bariatric surgery. The second part of the question was regarding how long she will have to stay in the hospital. Basically, bariatric surgery nowadays is done laparoscopically. So usually the hospital stay would be around 2 or 3 days. Once after surgery, a liquid diet is tolerated, you can be discharged from the hospital. So you can expect 2 or 3 days in the hospital after surgery.
So now moving on to the next question. Yeah. It's from Ikrit Sharjah. Doctor, I would like to know what is bariatric surgery and are there different types of bariatric surgery?
Bariatric surgery is otherwise known as weight reduction surgery. It is a type of surgery done on your stomach and small intestine to reduce your excess weight so that you can come down to near normal health. There are, as he has mentioned, there are various types of bariatric surgery. That is, the basic classification is that it can be either temporary or permanent. The intention of bariatric surgery is to reduce the intake. That means you restrict your diet by making the stomach smaller. That is one type. And the second type is that restrict the size of the stomach as well as reduce the absorption. So if you eat a little bit, only part of it is absorbed, and you can combine both of these also. So in temporary cases, what is usually done is a laparoscopic banding, gastric banding. That means you apply a band around a part of the stomach, and the size of the stomach pouch is very less, so you eat less. The second type is a permanent type. Permanent type itself, you have restrictive, that is you reduce the size of the stomach, that is one type of bariatric surgery, and the second type is you restrict, that is reduce the size of the stomach as well as reduce absorption. So the gold standard would be a combination of restriction and malabsorption.
The other question that he has asked is, how do I know if I am a candidate for bariatric surgery? And is bariatric surgery covered by insurance? And lastly, what are the risks of bariatric surgery?
You to become eligible for bariatric surgery, your BMI, that is body mass index, should be above 35. Or if your body mass index is above 30 with some additional diseases like diabetes or sleep apnea, that is you during sleep you are snoring and you get obstruction of the breathing, or some other diseases related to obesity, with a BMI of 30 and above, you are a candidate for bariatric surgery. If your BMI is more than 35, you are definitely a candidate for bariatric surgery. The second question is regarding the risks of bariatric surgery. Bariatric surgery is usually not very high risk surgery because many precautions are taken before doing bariatric surgery. Major risk for an obese person is higher than a healthy person. So there are general complications like you get after surgery and anesthesia. It is little bit higher in obese patients compared to other non-obese patients. Specifically, there are some complications after bariatric surgery, which is rare but which may be life-threatening. Is a leak at the site of where you join the small intestine and the stomach pouch, or where you create the stomach pouch, or there will be some bleeding from the stitches, site of the stitches. These are all rare complications, but may require re-intervention, that means re-operation or endoscopy or laparoscopy to deal with this. Usually it is not a very high complication rate surgery nowadays.
The next mail is from Isha, Dubai. Doctor, at what point is gastric bypass considered successful? And after the gastric bypass, are there any restrictions?
Any bariatric surgery for the sake is considered successful if the patient loses more than 50% of his excess weight. Excess weight means all people, all human beings have an ideal weight according to the height of the patient. If the excess weight is, for example, 60 kg, then ideal. If the patient loses at least 30 kg, then we can consider this bariatric surgery or gastric bypass as successful. If it is less than 50 kg, that is 50%, then we should consider it as unsuccessful. After gastric bypass, there are some restrictions in food intake which will be counseled by your concerned surgeon, because the quantity of food you take should be very less. The type of food you take should be restricted. For example, you should not take chocolates or sweets or you should not take alcoholic beverages, aerated drinks. So there are definitely some restrictions after gastric bypass, because these things can reduce the success of the surgery, as well as it can cause some side effects on your body.
Now the question that she has asked is it possible to have a leak that is not identified by the gastrograph X-ray study, and why does I need to follow diet before and after surgery?
There can be leak which is not seen by gastrograph study, but it is very rare. Usually gastrograph study is considered to be a good test to find out leak. If there is any doubt, considering the clinical condition of the patient, then what we usually do is a contrast CT to look for any leak, because that is more sensitive than gastrograph study. The second is about restrictions before and after gastric bypass. You need to have a liquid diet. It is ideal, what I am telling, the ideal. You need to have some liquid diet, low calorie diet before surgery, so that you can lose some weight. It reduces the size of the liver, because usually these obese patients are livers are very big, and it will reduce the size of the liver and the stomach. This will make the surgery technically easier. Not that it is 100% you should follow this, but it is ideal to go for some calorie limitation and diet restrictions before surgery also. After surgery, as I have said earlier, you should not take large quantities. You should abide by the dietary advice and don't take high glycemic index food.
The other question that she has asked is, how will my diet change in the long term, and how much weight can I expect to lose
after gastric bypass?
Yes.
Okay. The maximum weight reduction you can expect is around, for gastric bypass, is around 75 to 80% of your excess body weight. For example, if you are 60 kg excess, then you can expect around 48 to 50 kg loss after gastric bypass. And if in addition, if you continue to exercise and control your diet, you can achieve an additional 2 or 3 kgs of weight loss also.
Next mail is from Jahis Kofakan. Doctor, could you tell me what is dumping syndrome, and what other foods have a high glycemic index and might cause the dumping syndrome?
Dumping syndrome, to explain it in a simple way, what usually happens in a normal state is that when we have food, it is mixed well in the stomach and it is released slowly into the small intestine, bolus by bolus. That means it is sent in small quantities. So the hormones in the small intestine and hormones secreted from pancreas like insulin and glucagon can act in harmony. But when you do a bariatric surgery, what is done is usually the stomach pouch is very small and a small intestine is attached to the stomach pouch. This will bypass the some amount of normal route of small intestine. So what happens is that when you eat certain types of food, especially like with high glycemic index, what happens is that the hormonal changes occurring in the body is different from normal. So you will get a very low blood sugar after taking food, immediately after taking food, but your usual blood sugar level will be very high in the diabetic level. So you feel like lightheadedness, or sometimes you feel giddy, or sometimes you might have diarrhea immediately after taking such meals. In some patients it is so severe that they will have to lie down after taking such a meal. So this is called dumping syndrome. Basically it is the meal is dumped into the small bowel very fast, which causes these symptoms. Those food with high glycemic index are usually very high calorie food, which are very easily digestible carbohydrates like sugars, simple sugars, chocolates, and low fat pure carbohydrate diet. For example, the most common example would be a chocolate or sugar itself.
The other question that he has asked is, what will exercise be like after gastric bypass? And after gastric bypass surgery, when do I follow up with a doctor? Can I reverse my gastric bypass?
Let me answer the third question first. Gastric bypass is a permanent bariatric surgery operation. This cannot be reversed usually. The second question is regarding your exercise. Your exercise need to be continued as before the bariatric surgery to attain a good weight loss, because if you don't exercise, your muscle tone will get poorer, and what we intend to reduce your weight is by reducing your fat, excess fat. When you are not exercising, some amount of muscle protein is used for energy. So you need to have some high protein diet along with good exercise to maintain a good weight reduction and to maintain a muscle tone. Frequency of follow-up after surgery, what is usually done is that after 3 or 4 days of hospitalization you will be discharged, and the first review in the hospital would be around 2 weeks later or after 3 weeks, and then your diet pattern will change a little bit. Then you will be called back after a month or 1.5 months to go to the next step of the diet. That means you will be by that time semi-solid diet. In the long term, you need to be on follow-up at least 6 months or 9 months because especially after gastric bypass, we need to look for any vitamin deficiencies, because this is also a malabsorptive procedure. So a regular follow-up for at least 4-5 years is ideal to make sure that your health is maintained.
The last mail is from Sabah Alain. Doctor, can I expect post-operative problems with eating or bowel movements? And how long will it take to recover from the gastric sleeve surgery?
Gastric sleeve is another type of surgery where you reduce the size of the stomach. That means almost 80 to 85% of the stomach is removed from your body by cutting it off using stapler. Postoperative complications of sleeve gastrectomy is not very common, it is rare. The life-threatening postoperative complications would be a bleed from the stapled line or a leak from the staple line. These two might require intervention. Or rarely we can see persistent vomiting, or in some patients you can have reflux. Reflux is you will have some heartburns or difficulty in swallowing initially after sleeve gastrectomy. In the long term, the nutritional deficiencies of sleeve gastrectomy is not as high as gastric bypass, because this is not a malabsorptive procedure. Regarding the recovery after sleeve gastrectomy, in the hospital you need to stay 2 or 3 days after surgery, and you can be back to work probably after 2 or 3 weeks after surgery. That is the maximum. If everything goes uncomplicated, you can even be back to normal work in 10 to 14 days time.
The other question that she has asked is, how is gastric sleeve procedure performed, and what are the risks and complications of gastric sleeve surgery?
I think complications I have enumerated in the last answer. Sleeve gastrectomy is performed usually laparoscopically. You will have 4 or 5 small wounds on your abdomen, and by looking into the abdomen through a camera, we remove a part of your stomach, and you are kept in the postoperative observation room for a few hours. Then you will be back to the room most often the same day. You will be encouraged to walk as soon as possible, because this is a laparoscopic surgery, and as far as possible we try to make the patients walk on the same day itself to reduce the complications. And you can start on liquids on the next day or 1 day later, and you will be discharged from the hospital after 2-3 days. So this is the usual course of sleeve gastrectomy, and the complications that can arise is life-threatening complications are bleeding or leak from the staple line. These are very, very rare, probably less than 10% of patients experience.
What are the benefits of a gastric sleeve, and is there a risk of death with the gastric sleeve surgery?
Benefits of gastric sleeve is that it is reliable, reasonably reliable, that you will have a permanent weight loss. The another advantage of gastric bypass is that the chances of nutritional deficiency, that means vitamin deficiencies, calcium deficiency and all, is less in the long term compared to bypass surgery. The third advantage for the surgeon is that it is technically easier and less time consuming than gastric bypass to do a sleeve gastrectomy. So these are the advantages of sleeve gastrectomy. The chances of death after sleeve gastrectomy is very, very rare. The chances are less than 1% in safe hands if it is an experienced surgeon and good anesthesia team. But one important thing you should remember is that bariatric surgery is not a daycare surgery. It should be done by a team well experienced, because these obese patients can have complications, unexpected complications than the usual population. They are at high risk for cardiac complications like heart complications, lung complications, something like pulmonary embolism. That means you get clots in the veins of your legs and it can migrate into the lung vessels and you can have life-threatening complications. So this should be done in a well-equipped hospital where all these specialties can perform in tandem. So that is a very important point one should understand, because bariatric surgery is not a very simple surgery.
The last question that she has asked is, could I fail to lose weight after having gastric sleeve surgery?
Failure of gastric sleeve surgery is there. If you take it immediate postoperative, certain probably around 17 to 20% of patients may not respond favorably to sleeve gastrectomy. In the long term, the failure rate can go up to 25 to 30% in some cases. But the situation is that if you lose at least 50% of your excess body weight, then you can make it as a success. The causes of failure of sleeve gastrectomy is usually a technical problem, like the sleeve is not small enough. That means the stomach which is left behind is not small enough, or over a period the stomach pouch can dilate and you continue to eat more. From your side, if you are compliant with the diet, then definitely the chances of failure is less.
Doctor, so that was it for today's show. Thanks a lot for being a part of our program.
Thank you very much. Thank you for inviting me for this program.